Why have you applied for this job and why do you want to work here?
I think the first thing that made me want to apply for this job is the interaction that I had with you guys at the Physio Job Expo a couple of months ago. It was probably like the best interaction that I had there, and it just felt like very genuine. I enjoyed speaking um, with you guys and to learn more about Dunvale, and it just felt like this would be a really nice place to work at, and like it would be nice to work as a team here. Um, some of the things you mentioned was very attracting for me. So, for example, the mix of you know acute, subacute hospital work and private practice work as well felt great for me. Just because I've always been torn in between: do I work in private practice or do I work in a hospital setting? Just because I do enjoy both settings. Because I had private practice placement, which was amazing. Middle Park Physio, like it was just a great team. I've learned so much on that placement, but I also do love hospital work as well. So being able to do both at the same time um, is definitely one of the factors that really pushed me to apply for this job. I want to learn as much as I can, and I think being able to do a combination of those two work setting is, I guess, one of the ways I can make myself a more complete physio, because I think the skills you learn from a hospital setting or a private practice setting can be interchanged, and that's how you can give, like, I guess, the best possible patient-centered care to your patient. So that was one of the few factors that pushed me to apply for this job. The other factor would be the flexible working hours that you guys offer, and being able to, for example, work 4 days a week. You would obviously work longer hours on the first 4 days, but being able to have 3 days off, I think, is a great option to have, so you can have a better work-life balance. You could, also be working the second job as well, like casually, just to get more exposure to like different conditions. Patient, it could be like a more acute setting compared to like a subacute one. So I think that's another interesting option to have. Working as a grade 1 physio. Lastly, being able to do a 6-month rotation is, I think, highly valuable. Most places is a 4 months rotation, and then I think 4 months goes really quickly. By the time you settle in and when you start learning on the job, like, I think the time just flies by. While having 6 months to do your rotation, you can settle in and then slowly take your time to, I guess, assimilate all the different information, all the skills that you need to be successful on your rotation. And then you move to the next one, it's another 6 months. So again, I think that gives you time to like consolidate your knowledge, and yeah, just be consistent with your performance with that.
Next question. Tell us your achievements from your CEE experience and how you think these will help you succeed in this job.
So my placement at Home Physiotherapy was great. I'm still working for them, which is amazing. But being able to work as a allied health assistant and gaining, I guess, regular exposure, weekly exposure to different patient, different condition, just help build your I guess your knowledge first as a physio, so all your pathophysiology knowledge. It also helped to improve your manual handling skills, so you obviously see patients of various level of mobility. Some of them are independent, some of them need Mean Assist by one, and I had patients who basically they can't mobilize for themselves. So you actually have to use, like standing machines, stair steadies, or even like a hoist as well sometimes to actually transfer them, from the bed to the chair or chair to the bed. So in that sense, you just improve your manual handling skills, and you learn to use various tools that you will use at Donvale with different patients. I've also learned to improve my communication skills just to be more efficient, and I guess straight to the point with the patient, making sure that I'm not using any jargon words. So that's been great. I think I also learned to work as a team better. So I had to, you're always like communicating with the patients, their families, with Anna, who's like the practice manager at Home Physio, but also like the physios to keep them in the loop, because you only see the physio on the initial consult, just to do a quick handover, and then after that you are pretty much autonomous. So you set up your own appointments with your clients. You have to report to the care coordinators, so you send them like either like a fortnightly update, or it could be a monthly update. You need to be on top of that for your patients, and as well as keep your practice manager in the loop as well. So it's like continuously working as a team efficiently and making sure that the patient are getting the care that they need as well. I think working with Home Physios and AHA also helped me to be, I guess, flexible in my approach, and also to work under pressure. So you have like a certain amount of patients that, for example, I've set to see in the day, but obviously you have to tailor it around their schedule as well. So you can't always just be what's best for me. So it has to like factor like what time I can see my patient, and they're not having like like a wash, for example, through their care, personal care carers. So the factors you have to be consider and be flexible with, and I guess working under pressure, because you have, I guess, a time limit on how long you can see a patient, time it takes to travel from place A to place B, and you have to see all your patients in one day. So that can be a bit quite stressful, and I think being able to work with Home Physio helped me manage those tasks better. Another example would be as well when I had my uni placement, so my clinical placement for uni, which went for 5 weeks, and I had to juggle uni placement, my 2 AHA jobs, and 1 for Home Physio and 1 for Eastern Health. As well, I'll have time to look after myself, so that was quite challenging. And basically I had to like take time to first assess what I had to do. So I had to reduce the amount of patients that I see at Home Physio during the start weeks. I also had to reduce my working hours and days at Eastern Health, and work on Saturdays as well to try and basically fit all of his tasks in a week. But by the end of the 5 weeks, I managed to do it apart from placement, and I managed to take back the amount of patient I was seeing beforehand. So everything was quite successful. So I was quite proud of that, and I think those skills that I learned through this experience can be easily translated to my work at Donvale.
Great. Next question is, continuing education is important to this role. Which training courses would be a priority for you, and why?
I think the important one that I think I've realised is my vestibular knowledge is not that good, so I think I would like to improve in that regard. Vestibular condition was not really touched that much at uni, and also I didn't have that any exposure while I was on my placement. But while working at Eastern Health Hospital, or even through Home Physio, I've seen quite a few patients that had that condition, and at this stage I wouldn't be really comfortable managing those conditions as a grade 1 physio. I think learning more about it is important, and Angela, who is the owner and practice manager at physiotherapy. He's quite great at vestibular physiotherapy, and I've already contacted him to tutor me and help me learn more about vestibular conditions once I get my private registration. So that'll be the first step for me. And then I also did subscribe to all the vestibular PD courses through the APA. I think that's a great way to learn, just because you're learning, I guess, from the best physios in the field in terms of like vestibular conditions. So that'll be a great way to I think address this like knowledge gap and learn, I guess, be more proficient at vestibular conditions, so I can manage those comfortably at Domdale Hospital. The other courses I would like to do is dry needling courses. I think it's a great way to try and help your patient temporarily by like addressing pain or like revealing like stress as well. Learning more about manual therapy is also another skill that I wanted to get better at. Like, you've done it at uni, but you don't, because I guess at uni everyone is pretty much doesn't really have any serious medical conditions, or we're all like healthy. So I think learning more about that through the private practice at Domdale would be great, just so I feel more comfortable to try and use that in my everyday practice, and or even at the hospital while I'm with other patients as well.
And final question, what are your career goals?
I think to start, I would like to work as a grade 1 on a full-time basis, and being able to do my rotations for those 2 years, because I believe that's how you would learn the most and be a more complete physios. You only learn the basic at uni, and I think you learn the most while on the job, seeing very difficult, challenging conditions, patients on a regular basis, and also learning through, I suppose, your peers and your supervisor. So I think that'll be the first step for me. So that's one of my goals, and then by the end of my rotation, I would like to move to a grade 2 position, like a role. I'd like to specialize in one field. I think at this stage, I would really like to specialize in respiratory conditions or acute neuro as well. I had really great experience in those fields while I was on placement, so I think that's why I wanted to be learn and get more specialized in those conditions. Being a grade 2 as well, it means that I can also act as a supervisor for students as well, and I think that's something that I always wanted to do. So I think I enjoy teaching, and I think it'll be great to be able to pass, I guess, the knowledge that I've learned to other students as well. And I think if you can learn how to teach people effectively, then that can also help you in terms of helping the patient. So you'll be, I think, more comfortable to, I guess, explain things in a more simple manner to your patients. And also it can test your knowledge as well. So obviously students ask a lot of questions, and you need to be, I guess, comfortable and efficient at teaching people. So it doesn't mean that I have to always be on top of my game as a grade 2. I think potentially moving to the UK would be one of my goals as well. So a few of my friends did the jump from here to the UK to work as a physio. And they all reported that it was a great learning experience, and then that they became a more complete physios, and I think I would like to do that as well, if possible. And then finally, one of my goals would be to be a grade 3 as well. I would like to be a grade 3 and be able to have a more senior role, but also keep my clinical time as well, because I do enjoy interaction you get with your patient as well. And I'm sure like as I grow, my goals will also change. So, but at this stage, yeah, it was on my career goal at the moment. Stop it. Is it